I think this is extremely challenging, because if 5 percentage points of the overall healthcare expenditure is going to oncology care, and 10% out of that is going to drugs, we really have to ask ourselves what the most efficient use of care is. I know that there's a lot of people focusing on that other 90% of care, so looking at what's happening in hospitals and in normal practice. So there's innovative bundling initiatives, there's looking at other ways of shifting the site of care that I think are healthy for the system. But if we focus on drugs, I think there's a couple things that are going to happen. And specifically in hematology, we're looking at loss of exclusivity, and we're looking at biosimilars, which are finally coming to the United States. I think in the long term, though, we also have to define value better. And there's initiatives such as Choosing Wisely by ASH and ASCO, putting forward things that the community can do today to try to help not only save costs but improve outcomes for patients. But I also think there's things that they can do, such as the Value Task Force. And in the Value Task Force, what they're trying to do is actually define what value looks like for medications. These are some of the initiatives that I think can go forward in helping involve, let's say, more rational use of resources. I think that the patient's voice also needs to come out more clearly, and so as the patient gets more involved, they also have to articulate what value looks like.